Hi everyone, welcome to our virtual T-Shape 2 event. I'm Alexa Borodiak, I'm a PA here at Bucky Plastic Surgery.
And I'm Kim Jacobs. I'm a body contouring specialist at the Body Center, and we're really excited to educate you on the latest body contouring technology.
We are so excited to be one of the first practices in the country to offer this new innovative technology called T-Shape 2. What I love about it is it's a multi-modality approach. So there's low-level laser therapy, there's radio frequency, and there's also suction that all help to improve blood circulation. It helps to strengthen and tighten the skin, stimulate collagen, and also reduce the appearance of cellulite. I think we have so many patients at our practice that are in their 40s, 50s, 60s that, they're exercising, they're eating healthy, but over time, our skin quality is not as it once was when we were in our 20s and 30s. So this treatment can really help to improve the skin quality of patients, that are unhappy with their posterior thighs or their buttocks or their arms, their abdomen. There's so many different areas that have some room for improvement. So there's really zero downtime with this treatment. It is good for any age group. It's great for any skin type, and it's a relatively comfortable treatment. So patients are really interested and excited about this.
So what do each of these modalities do? We're going to get into it. Our low-level laser therapy, what it's designed to do is move over the body part that we're treating. It will reduce the circumference of the body part that we're working on. So you'll technically be losing inches in your belly if we're working on your abdomen, in your front or back of your legs. Your whole trunk can be reduced in size because we can work on your back as well. It also improves skin texture and tone, and can help with blood flow in the particular area that we're treating in. It works in conjunction with lymphatic massage as well.
The machine also includes radio frequency, which this technology uses added heat to further tighten the tissue and stimulate additional collagen.
A third modality is vacuum suction. There are 4 different speeds that are associated with this modality, depending on how much we're trying to increase blood flow and circulation depends on the settings that we create, and it also helps to tighten skin.
Lastly, deep massage improves your circulation. So here at the Bucky Body Center, Dr. Bucky's done an incredible job becoming one of our largest weight loss practices in the area. But unfortunately, as we age and as we lose weight, we're losing volume in our faces and our bodies, and skin is becoming a little bit more lax. T-Shape 2 is an amazing technology to be combined with a weight loss medication like a GLP-1, just to help amplify your aesthetic outcome, to help promote collagen stimulation, to help with your skin texture, to help with your tone, and also with no downtime.
So the ideal patient is basically anyone. Anyone that's looking to lose inches, anyone that's looking to smooth out skin, to increase elasticity and collagen. It basically covers all the bases. There isn't anyone that wouldn't be considered a candidate.
So I think an important thing just to discuss is every patient presents differently clinically, obviously, and we're going to do whatever's best to whatever your concerns are. What's really nice about this technology is it is approved for all age groups. It is approved for all skin types. And like I said earlier, there's no downtime. We do not have a lot of modalities here at Bucky Plastic Surgery where there's no downtime. Obviously, working for Dr. Bucky as a plastic surgeon, I think it's really important for patients to come in for their consultation. The medical providers will assess you, and if you are better indicated for a surgical procedure, of course, we're going to guide you in that direction. A lot of patients can get really great improvement without having to undergo surgery. So really, totally depends on what your concerns are. But that's why it's so nice coming to our practice, right? Because you have a medical provider that's able to do your consultation, and we're able to guide you in the correct direction, whether it's something very minimally invasive like T-shape 2 with no downtime, or if you are a surgical candidate, we can help to guide you in that correct direction.
Hi, my name is Kim Jacobs. I'm the body contouring specialist at the Bucky Body Center. What brings you in?
So I've heard a lot about T-shape 2, and I saw that you guys now have it here at the Body Center, and I just want to see if I was a candidate for it, the benefits of it, if I'd be happy with the results, how long it takes, just kind of everything there is to know about it.
Well, I'll do my best to try to give you the rundown. You're definitely a candidate for it. Anyone between the ages of 20 and 80, we have done treatments on, both male and female. Any body part that you're looking to do some specific contouring on?
I heard that you can kind of do it everywhere, but I think my abdomen area, the love handles on the sides, just core, but I've heard you can even do it on like the back of your legs, the thighs, everywhere, the arms.
So we can do up to 2 areas at one time. You can start with your core. We recommend 12 sessions. You're going to be coming in 2 times a week for about 6 weeks. It's okay if you come in once a week, but we like to try to condense the sessions so you can get the results a little faster. Each session takes about 35 to 45 minutes depending on the body part that we're doing. And sometimes people will do combined areas like their core and their hip flanks, or muffin top area, or their inner and their outer thigh. We can also treat arms. We can treat almost anything from the neck down. We can treat above the knees. It's really nice because they're very specific to the area that's being treated. And sometimes over the course of the sessions, the heads that we use on machines may change because we can get very specific into what we want to do to get a little more detailed in the contouring that we're trying to provide.
Thank you all for attending our virtual T-shape 2 event.
We hope you all feel better educated about this fabulous new technology, T-shape 2. And don't forget to check your text messages so you can schedule your T-shape 2 consultation.
We now invite you to a live Q&A for the next 15 to 20 minutes to answer any questions that you may have. Hi everyone. Thank you so much for joining. So again, I'm Alexa. I'm one of Dr. Bucky's PAs here, and this is Kim Jacobs. She is our body contouring specialist. Kim has done an amazing job with T-shape 2 here at our practice, so we're so excited that you guys are here. We're going to get started answering some questions. So first and foremost, our first question is this treatment safe for all skin types and tones? The answer is yes. T-shape 2 is approved for all different skin types, all different skin tones, all different age groups. It's a great treatment with no downtime, which is super exciting. Next question I'll ask you, Kim. Is this treatment available in Ardmore?
Not yet. Right now, our only place is at the Body Center on Sansom Street in Philly, but
you never know.
maybe
in the future. The next question is, there's actually a lot of patients asking similar questions, so we'll continue to go through it. How does this compare to treatments like Morpheus and other treatments? So this treatment, T-shape 2, if you're interested, just remember guys, you're about to get all of these pop-ups. If you're interested in a consultation, please make sure that you select that you want to be contacted. How does this compare to other treatments like Morpheus? This is a minimally invasive treatment, so there's no downtime. I will tell you, working at this practice, operating all these different machines, I really don't have very many devices other than T-shape 2 that has no downtime, so that's very exciting. Things like Morpheus, Ellipore, obviously there's a lot of downtime associated, and there's pros and cons kind of to every treatment that we have at our practice.
And there's also like no restrictions. So if you get a treatment done, you could go out that night, you could still go to the gym. There's not even going to be anything that's going to prevent you from being seen in public after you have one of these treatments.
The next question is the procedure available if the patient has replaced hip joints?
It is, we just can't go over the specific area. If there's metal in your body, we can't go over that specific area.
So contraindications,
you're currently pregnant, if
Nursing.
you, or are currently nursing, if you have any metal in your body, obviously we do want to avoid the area, but particularly obviously if you have a pacemaker, you would not be a good candidate for this treatment. The next question is, what makes T-Shape 2 different than other body contouring treatments? I think what stands out about this treatment is it is a multimodality approach, which means we're using different ways to help skin tightening, to help improve your aesthetic outcome. So it's almost like using multiple different machines in one platform to improve your overall outcome.
It has more heads than any of the other technologies on the market. So you can do, instead of just having one machine that helps with laxicity or one machine that helps reduce the circumference, we can get it all with one machine using different heads depending on, what the specific outcome is intended.
And then, what does a T-Shape 2 session typically feel like?
I've had a lot of people say it feels like a warm massage. It's not, it isn't uncomfortable. The temperature is controlled, and it's something that we would set up between us. Like if it doesn't feel right, all you have to do is say it's a little too warm, and we can change some of the settings on the equipment. There's a vacuum setting. It feels a little bit like a little like endermology. It doesn't hurt. It's very painless, and I've had some people fall asleep on the table, so it's kind of nice.
That's nice. I can't say that about any of my patients. That's great. Yeah. Next question is, can T-Shape 2 be done postpartum?
I just met like Dr. Clearance.
I would say overall, obviously, if you had like a cesarean section, if your incision's not fully healed, obviously we would not be treating you. It's kind of a case-by-case basis. As long as you're fully healed, I would want to wait at least a few months before treating you. But if I would say you're 3 to 6 months post-baby, I think that would be completely okay to treat. Cost.
We bundle these in sessions of 12. That's another thing, a whole other section that we'll get into because I know those questions are coming too. We bundle them in a package of 12. It's recommended that you come twice a week, but it's not mandatory that you come twice a week. The reason we do that is because we want you to get the results as fast as possible. So within 6 weeks, we'd be able to accomplish 12 sessions and you'd get your best results after 12 sessions. And that cost is $4,000. And it's per area that we're treating. So that would be for your abdomen or inner thighs or back of your legs or your hip flanks or even your arms. And we can also do multiple areas. So it would be per area, that would be the charge per area. But you can get a break because we're
Offering the discount.
offering $500.
I actually just wanted to bring up really quick. So Kim has been doing so amazing with all of our T-Shape 2 treatments. I just wanted you to quickly talk about like, how has your success been so far with patients?
First of all, I can see it when they're laying on the table. Like I can tell just after a couple of treatments that you can see the size reduction right away. Starting to see a lot of musculature in like abdomens on the back of legs. Everyone's been really excited about their results. Actually had a couple of people that we always are begging people to like write reviews for us or put something out in the universe to say how happy they are. And now that this is such a new modality and not that many people know about it, a lot of people have been willing to say like, I'm not even finished and I'm
Already so
ready
happy.
to write a review for you. So
Well, that's great. How is this priced? We already discussed $4,000 per area, and that would include all 12 treatments, correct?
Yeah.
How long do the results typically last?
They are, I'm just gonna put it in the universe. They are something that if you take care of yourself, you want to make sure that you're still working out and eating properly and hydrating yourself. The results are not going to go away. We do suggest that maybe some maintenance after about 3 months that you may want to do like 1 or 2 treatments a month just to kind of refluff and keep it going. Haven't really had too many people that have had to come back and do that yet. But there are people that have purchased maintenance packages and are just banking them because actually they're probably going to wind up using them on other body parts.
I think ultimately, just having the experience of operating other devices here too, typically a patient comes in and there's a corrective phase, which is a little bit more hardcore. for example, like during your 12 sessions, and then you kind of just maintain your results. And unfortunately, just like with the gym, if we stop going to the gym, our results are no longer going to be present. So the goal is just to continue to maintain, do your lifestyle changes and dietary modifications and continue to maintain your results. Okay. Do you need to do anything prior to prepare for these treatments? Other than hydrate, what else would you tell
Hydrating
patients?
is the most important thing.
Mhm.
The only thing that I put into the universe is like if you do anything at the gym with saunas or steams, you probably want to avoid it the day of treatment, just because we want this to work through your lymphatic system. We don't really want you to, you can still go to the gym and do your workouts, but we don't want you to sweat too much and have all of this be removed from your pores. We want you to be able to use your lymphatic system to eliminate what we break down during a treatment.
Mhm. How well does this work for cellulite?
It works amazing for cellulite. See it like that fibrous tissue gets broken up with one of the settings that we have on 2 of the heads that we can use depending on how quickly your body responds to it. It breaks it down, smooths it out. It's kind of amazing.
Yeah. Ultimately, too, I kind of just like to talk about other little things. Ultimately, cellulite is caused by these fibrous bands that are pulling down. They're called adhesions, kind of pulling down, creating that cellulite depression. I think because of like the suction and the vacuum and the radio frequency, I think it can help plump a little bit. But ultimately, if you have those dips, you might need, if you're looking for a permanent correction, we have a device called Ovally, which actually helps cut those fibrous bands to help everything kind of even out and for a better textural outcome. Again, this can be done great in conjunction with something like T-Shape 2.
We have like a lot of your patients that are doing the Ovally.
But I think that's the most important thing, right? So we work at a plastic surgery practice where we're able to correctly guide you in whatever would be best for your body and your concerns. Next question. Does the procedure actually kill or reduce the fat cell? How does it reduce skin cellulite?
Well, it reduces the skin cellulite, just basically what Alexa said. It kind of breaks those fibrous bands up, and it's not killing any of the fat cells. It doesn't remove them. It's not a surgical removal of it. It basically, we always say the more you drink, the more you shrink. It's how you're going to eliminate it through your system. It works with your lymphatic system to remove what's broken down.
I think with the suction, obviously helping with your circulation, helping with the radio frequency, the low level laser therapy, these are ways to help kind of plump up the skin in that area. To say that it actually removes like cellulite depressions or bands, I think wouldn't be medically correct. But overall, I think the goal is just to improve the look of the cellulite. Does it work for bra fat?
It works for every fat. I mean, anything literally from the neck down, we can treat. It works. It's great. It's great at lines like from your armpit down to the top of your hip flanks, front and back. It doesn't go over breast tissue, but it works in every area from the neck down.
This question you're going to love, Kim, because you want to talk about this. Is this treatment good for patients on GLP-1 medications like Ozempic?
I love when people are doing this in conjunction with any of the GLP-1s, because you tend to find that it's a new way, a relatively new way for people to be losing weight. And sometimes the weight loss gets ahead of a safe way of doing it so that your body can maintain some of its musculature and bounce back from having like that skin laxity. People are seeing a little bit more like laxity in their arms and above their knees. And what's really nice about the T-Shape 2 is it's great to tighten the skin in those areas. That's a great collagen producer.
Wow, I'm surprised at how many questions. 29 new questions. Okay. Can you have your arms and legs done at the same time? What is the pricing?
Okay, so yes, you can have multiple body parts done. We will do up to 2 areas at the same time. And again, we had talked about this earlier. It's $4,000 per treatment area. So you'd be able to do your arms and legs. The regular price for that would be $8,000.
How many treatments are typically recommended for best results? I think we already kind of talked about the 12 treatments, and they would be as soon as like twice a week. And how often do I need them? So it would be twice a week, every week for 6 weeks.
But we've done that
But
for
you can
people
prolong
once a
it.
week. And we've
Yeah.
also had people that have come like maybe 2 times a month. It's not, there's nothing wrong with doing them that spread out. It's just, it delays your ability to see the result.
Do you have a gallery of pictures showing before and after, specifically upper arm and inner thigh area? I think we're currently really working on our before and afters, but hopefully we have a good before and after gallery soon. Artemis definitely has a bunch on their website, so if you want to check that out after this, you're more than welcome to.
That's a good go-to. Yeah, Artemis website.
Can you do more than one area in a treatment?
Sure.
There's a lot of repeat questions. Okay, if you've had Morpheus treatments in the past and didn't get the results you were looking for, would T-Shape 2 be the best next option or no? I think this is a complex answer depending on who you ask. Personally, with Morpheus, we are creating a controlled injury using little needles with radiofrequency, which is added heat for further skin tightening. So this is a little bit more invasive, whereas T-Shape 2 uses different types of modalities to approach the same kind of concern. So you can talk about like your experience with it.
The biggest suggestion that I would make is that a consult is really important. It's hard to say without seeing everyone individually.
I think clinically, like what your presentation looks like, what your concerns are.
It would dictate the heads that we would use, and depending on how soft or fibrous the tissue is that we're treating, if you have done Morpheus in the past, it would just come at your skin or your cellulite just from a different perspective. Yeah. Thank God Alexa can see without her glasses.
How much does it cost? How much does it cost? How much does it cost? Can it be combined with other treatments like body injectables? Yes, I feel like something very common is injectable biostimulators, and they work very, very well together. I do think this is an important thing to talk about, though. We like to space out our fillers with this treatment by 4 weeks, right?
Yeah.
Do you wait less than that? I think 4 weeks that's how long we should wait for T-Shape 2 treatments, just to make sure that they're not interfering with each other. We never want to cause, any issue with the filler. So you never want to heat up the filler too much so it moves and it doesn't work as correctly as it should. But yes, and that would probably give you your best aesthetic outcome, in my opinion. How much does the consultation cost, and is a demo included in the visit? So our consultations are $100. Is a demo included in the visit?
Not typically,
Yeah.
Because the demo would be really hard to do in one quick session.
Yeah. What I'll tell you is I am a little bit of a baby, and we've practiced just so I can feel what it feels like.
Yes.
It's really not painful, and it really is no downtime. So if you're nervous about it, I want you to think of it as, okay, my skin type is safe. My age is safe. I don't have any contraindications. This isn't going to be too painful. It feels a little bit warm, but other than that, and there's no downtime, so I don't think that you're going to have any issues. Can you do this after surgery or liposuction? The answer would be yes.
Absolutely.
However, we just want to make sure that you do it at a safe, obviously, period of time.
And what's really nice about doing it in conjunction with something like liposuction is like lymphatic is a big one, but it just helps to further smooth out the area that was above and below wherever the lipo was performed. So it's really nice.
How long does a single session take?
About 30 to 40 minutes, depending on the area that we're treating.
Still more questions. Okay.
This.
Is T-Shape 2 more for sculpting or sizing, or can it improve lax or older skin? Again,
Yes, all of the above.
Again, though, we just like for you to come in for consultation and see what would be the most appropriate for you. Obviously, if you're looking for like a dramatic improvement that would make me feel like you would be a better surgical candidate, then of course we're going to guide you towards the surgical process. But if you're looking to just contour a little bit, I think that this is a really great treatment. As far as skin laxity, though, because of the suction, because of the radio frequency, the low-level laser therapy, this could be nice for skin laxity as well. Okay. How quickly can you see results? as soon as 2 to 3 treatments, would you say?
I mean, I've had a couple of people that have seen like the smoothness in just one session, but it just adds to it. I would say 2 to 3 sessions is typically the right amount of time to start to see something that you can actually notice.
If you wanted your legs done and your stomach, it would be $4,000 per procedure and then 12 sessions per each area.
That's correct, yes.
Do you like this better than other machines you have? Again, it depends on your clinical presentation. I think this is great in the sense that there's no downtime. If you're better suited for something more aggressive or invasive, we are going to guide you in that right direction. So for what it is and the multimodality approach, I think is super exciting. The results actually have been really, really good. So we're excited about it. It doesn't really take the place for any of the other machines that we have here.
Right.
But I think it just is like an added bonus. It's a great machine in conjunction. Like I'll give you guys an example. Kenny and I are Dr. Bucky's PAs, and we do a lot of ovally, which is this almost like wand that helps cut the bands of cellulite. This is a great treatment option that we could do in conjunction with ovally. Both are not competing with each other. One is just breaking the band, it's physically cutting it, and the other is working on the skin texture, the laxity, improving, it's helping with the suction and the radio frequency. It's doing all these things that ovally wouldn't be able to do. So I think that it's a great added bonus. It's a great added device to our practice.
It just makes the results from having that done even
that much better.
Much better.
Yeah. What are the problem areas that this treats?
So we do, we do everything from the neck down. Anyone that's dealing with like some hanging skin under your arms or above your knees, that pooch that kind of hangs above your pants sometimes, muffin top areas. Been doing a lot of backs of legs. Any area that you're trying to either make smaller or smoother is just, it's exactly the solution for it. If you've got a vacation coming up, this is that time of year. We always talk about how winter is, this is when summer bodies are made. That 12 sessions, 6 to 12 week time period, you can have all of these body parts looking fabulous by the time you're ready for a trip or a reunion or a wedding or next summer even. So
yeah. Have you seen good results for men?
yes, do a lot of treatments on men. It's really nice because it helps to create that. If you look at someone from the back, that nice
contour, yeah.
V creates gets rid of those muffin tops or those.
It's so interesting that everyone kind of has similar questions. Is this a good solution for those who lost a lot of weight using GLP-1s and now have excess sagging skin on stomach, buttocks, etc.?
Absolutely.
Are flanks and abdomen considered separate areas?
Yes. We depending on the width of your body, try to go as far left and right when we're doing the treatment.
So you could probably extend out a little bit.
It depends, yeah. It depends on how wide someone is. The treatment area is timed, and I don't want to spread it out over 2 areas.
So you
want to
get
be able to
a
get the
result.
best results from that one time. So we do combine it into 2 areas.
I currently do M-Sculpt Neo maintenance. There's 2 questions about M-Sculpt. I just know from my last practice that I worked at, M-Sculpt uses high-fem technology, whereas this technology is multimodality. So this just uses more mechanisms to get you to where you want to be.
Yeah, there's different modalities in addition to what M-Sculpt does. We have had some people who have done M-Sculpt that are now trying this and getting much better results.
How does this compare to skin tight? Very different than skin tight. Skin tight is we're adding heat underneath the skin surface to tighten the skin, obviously more invasive. So they're just 2 totally different treatments. This one's way less invasive and no downtime. Can the $100 consult fee be applied to the treatment total as a credit?
Yes, absolutely.
Is there a payment plan or do you have to pay in a lump sum? I'm sure that we definitely have some payment options, so we will definitely talk about that at your consultation.
That's something we can
talk about
at
it.
consult. Yeah.
Yeah. Okay. Update to my last question. How does this compare to body tight skin tightening?
and Elocore microcoring. So body tight and skin tight in general, like face tight and body tight are both similar. There's added heat underneath the skin surface to allow for skin tightening. So that's all
Amazing technologies, by the way. So
yeah,
that's something that
amazing.
interests me.
Very,
We can push you
a little
towards
bit more
that.
invasive. Elocore is another treatment that I do at my practice. Also pretty invasive. We're taking microscopic hole punches of your skin away, and the skin further heals by tightening. We love it. Elocore, she's one of my Elocore patients. I've
I love
done
it.
three Elocores on her,
Yeah.
so we love it, and that's actually removing, it's hole punching out tissue to allow for your skin to further tighten. Obviously, with this treatment, it's just totally different. This
A lot of
one
different
treatment is
downtime and.
yeah, one is taking tissue away, so obviously you're gonna get some good skin tightening there. And this is way less invasive and no downtime. So it really just depends on like what your goals are. I would say for a patient, honestly, face in general, I probably wouldn't, T-shape 2 wouldn't be the first device that I would use. For perioral lines, I probably would choose something like Elocore, which is gonna give you a better long-term outcome. But you know, there's some areas, like I think the abdomen is a perfect example of like, we would love to take away a lot of laxity with Elocore and then maintain with T-shape 2
Yeah.
to improve your best aesthetic outcome would be like a good plan.
And we've been kind of shying away from doing any of the T-shape to the face, just because you're all spending a lot of money to take care of yourselves with any filler or Botox, and we wouldn't want to damage those results.
Okay. Let me see. So patients keep asking about treatments. It's each body part is going to be $4,000. You will get your discount because you're on this webinar. That will be for a total of 12 sessions. Okay, so that's how much it will cost to treat one body part. If you want to treat an additional body part, that would be an additional $4,000.
Correct.
And then I just want to remind every patient that you will be receiving a text message at the end of this event. So please make sure that you reply with the text Bucky to be contacted for a consultation. Does anyone have any last questions for us?
We would so love to see you for some consults.
Yes. Well, we really enjoyed. Thank you guys so much for being so interactive. This
We
was like
appreciate
a
it.
ton of questions today.
Love all the questions.
So we hope that you guys feel better educated about this whole process. If you have any further questions, come on in for your consultation, and we would be more than happy to take care of you and address them.
Love that. Love to see you. We hope we do. Take care and have a great rest of your night.
Yeah, I hope everybody has a great night.